We're just saying that spider web will never come down. I honestly think the building will come down first and the spider web will be there. And as we continue our conversations with OSF Healthcare, Charlotte and Staci, you guys have been in here before. And Shannon, it's nice to meet you. How are you doing today? Well, and now today we're talking about National Recovery Month, and I'm really glad that we're having this conversation because, addiction really does affect all of us in some way, shape, or form, whether it's us directly, a family member, a friend, or someone else that's just close to us. And as we, kick it off today, let's talk about National Recovery Month. What is it?
Yeah, so, actually hearing you talk about it really kind of brings tears to my eyes because it does, as OSF, our facility, we really do value our community. And so August 31st actually kicked off Overdose Awareness Day. And so then that kind of puts us into the recovery month. So it's a month that we celebrate people that have taken those steps towards recovery, have, maybe know people that are in addiction, looking for that to kind of, heighten awareness around what it is that we offer and how we're here to help.
Well, and I'm glad that there's more of a conversation on it too. And there was just an organization I have, Foster's Light in the Dark, that did a overdose awareness event over at Riverfront Park, and it was really beautiful. And it's things like that where the more you talk about it, I feel like is the destigmatization goes away a little bit or starts to improve. And with that being said, whenever it comes to addiction in healthcare, I'm sure that it's in many forms, and it does affect the way that you can treat patients and the type of care, we receive. And take me through that at OSF Healthcare. Whenever you're working with somebody that, might be battling or going through something, and Shannon would love to hear from you too, is there a lot of times where their overall physical health is also not where it should be as well?
Absolutely. So that is, I'll let Shannon kind of tell what New Vision is really about, but it's a company that we team up with them as an introduction to kicking off their recovery period, right? It's a medical stabilization, it's a detoxification, 3-day inpatient stay where we can, offer services. So I'll let kind of Shannon talk to that.
Yeah, Shannon.
Yeah.
Okay. So like she was saying, it's hospital-based, medically supervised, withdrawal management, and we withdraw from alcohol, opiates, benzos, cocaine, methamphetamines, which I think we're the only place that does strictly methamphetamines alone. And like kratom, we will do kratom. And then we help with like discharge planning, stuff like that. So like if they want to do residential or outpatient.
So you help them with that transitionary period. That's really important. Well, and now take me through the eligibility a little bit. How do we qualify for programs like this, and what's that kind of process look like?
Okay, so you have to be 18 or older.
Okay.
You have to be in mild to moderate withdrawal, and
meet the criteria, really, some of the criteria around being in, withdrawal. So, yeah.
Well, and fill me in too, Shannon, because I feel like it's not really an age-specific thing, and you guys work with all walks of life. Is it one of those things where it really is just such a diverse group of individuals that you work with on a given day?
Yeah.
Really anybody, right? Anybody can walk through the door. I mean, as you mentioned, very first off, many of us have been touched by, addiction in our experiences, personal and professionally. And, you could have a job every day. You could not have a job. You could be a man, a woman, kids, families, married,
Grandma, grandpa.
Yeah.
Right.
That is a great point because we see every age that it impacts. And that's where Staci and her team,
We are so fortunate to have New Visions at our facility. It really provides a bridge for the community. So someone would access a New Visions type service when they are physically dependent on a substance, right? So this would mean that they would need to be medically supervised, and it's a 3-day period monitored with a protocol by doctors and medication. And at that point, from my perspective as an outpatient department, I think a lot of people are going to be able to go to a rehab after that. That would be a good discharge. But some people do discharge home. And so New Visions has a pretty complicated task on finding the appropriate resources and ones that meet insurance needs, because that's a big deal too. Who accepts commercial insurance, who doesn't? And so that's where we kind of come in the outpatient department, is once they've completed their detox, and let's say they went to a 28-day rehab program, so then they would need to follow up with care in the community. And so that care in the community would look like outpatient department treatment, which we provide. And we have a newer therapist, I think you've met her, Marla Nelson, who does tremendous work with substance abuse disorder. And in fact, she has just added to her collection of services. She's created a new group called Pathways to Peace, which is aimed for 12 to 14-year-olds who are living with someone who has a substance disorder.
Wow, that's incredible.
Okay, it truly, truly is. We also offer Al-Anon, but this group is really important. There really isn't anything like this around. And so some of the things a group would be looking to do would be to provide education about addiction, how to set loving boundaries. Now, that's a concept for a 12 to 14-year-old, right?
Right.
Like, usually boundaries are being put on them.
Right.
But in these households, we've got a different family dynamic going on. Self-care, instilling hope, and moving forward, and what does life look like outside of addiction? Like, how do you envision a future when what's been modeled may not be the path that you want to choose? Where do you start?
This is such an incredible group.
Yeah, it is. I am so pleased. It's going to be on Tuesday evenings from 5 to 6.
How do we register for that?
So, like all of our groups, you would call our main number, 618-474-6240, and request an intake as a new patient. And this simply really is to get you acclimated to the department and make sure you're ready and appropriate for a group. Sometimes you may need a few individual sessions. Maybe the pain is just so at the surface that you need some one-on-one time before you go into the group. But it's that simple, and we accept almost all insurances, including Medicaid and Medicare.
That's really important to note. And I think, now, how is this group brand new?
It's brand new.
Wow.
We just started actually this week.
Oh, wow.
This is our first week.
Well, how did that first session go? Did you get a chance to ask?
So it was yesterday, and I haven't got to touch base with the therapist
I just think it's really important that you're providing that, because like you said, if the only thing that you can see for a future is what's in front of you, around you all the time.
Exactly.
The hope aspect of that is really huge too.
It is.
And I think it's great that OSF, with partnerships with New Visions and everything else, from therapy all the way down to the actual healthcare service side of things, it's a wraparound where you aren't just saying, all right, here's step one, now good luck in finding step two and finding that transitionary period. How important is that, do you guys think, to have where you guys are all within that same network or that same branch of communication?
Well, it's just that continuum of care for our patients. And you mentioned them having other types of health issues, right? So if they come in through the medical stabilization program, through New Vision, and we see that they are struggling with, other health issues, obviously at home, they may not be taking care of themselves.
Right.
So, what other things can we help them get through? And then we want to ensure that they're successful in their life. We don't want them to keep coming back. We know often that this journey for them is starting with us, and we want to see that it ends with us and that we continue that support. And even after, Staci's team might not have any more, be able to offer more counseling or anything else. I mean, I'm sure that they have more resources that we can connect them to, because their support outside of their world is everything to them.
It truly is. So that same patient will, possibly touch so many different departments at St. Anthony's. Whether it may be an emergency room visit at one time, or finally having the courage to talk to their primary about some of their concerns, and their primary making a direct referral to New Visions, or even maybe making that referral to us first, and a therapist talks to them about their options, that we do have a medical stabilization. So it truly is all connected. The continuity is amazing.
Well, and it seems like too, it's for a long time people had to go a lot of other places to receive this care, and to have it within this region of ours, and especially this area, it's really great to note that we don't maybe have to wait and see about a 45-minute transport or an hour drive away to get the help that we really need. Do you guys have a moment to take a break?
Yeah,
Let's do that. It's 9:30, and we'll come back with a little bit more of this conversation. It is National Recovery Month. We're talking with our friends at OSF St. Anthony's Health Center about this and the great services they provide. More next.
Throughout all life stages, you need someone in your corner, guiding you on your health and wellness journey. At OSF Healthcare, that's your primary care provider. Your OSF primary care provider is there for every stage of life. Find a provider today at osfhealthcare.org/primary.
Not sure if you've noticed, but those advertised prices from the other dealers are just a bunch of blah, blah, blah. At Roberts Motors, the advertised price is the price you pay. And that, my friend, is great news for you. Don't fall for their so-called incentives that will leave you banging your head against the wall. Go with Roberts Motors. Prices you can trust and people you will like. That's the Roberts Motors way. And trust me, it's the way to go.
Has free checking become a thing of the past? Not if Liberty has anything to say about it. With 3 free personal checking options and even a free business checking account, free is alive and well at Liberty Bank. The local bank that gives you free checking choices and more cashing in your pocket. Bank locally, bank Liberty. For more information, visit www.bankliberty.com.
You're listening to Our Daily Show with CJ Nasello on RiverBender.com.
Daily Show, 9:32. Welcome back on a Wednesday. It doesn't feel like a Wednesday to me, and this heat is kind of driving me crazy. I'm just, we're almost there.
Through the week.
We're almost to Thursday when it's going to be back below 90 degrees, and then life will be looking a lot better. And it's really good to know, too, just going back into this, that if you know of any individual, if you're a school guidance counselor out there that watches this show, or anybody in somewhat of that kind of mentoring role, please tell these children about the Pathways to Peace, 12 to 14, right, Staci?
Yes. Mm-hmm.
And really good notes there, because that's a great service, and hopefully we can get them connected and get them signed up. And as we start going back into New Visions, I think the big thing is that it's all payers, correct, for this type of service, which is really big, especially when it comes to working with, your guys' hospital. That's a really big deal.
Yeah, it is. And I mean, that just, again, we try to, gear everything towards the community's needs. And so you come to us and we will work with you and try to figure that out. I know their team, I'll let Shannon give that phone number to their office, so that in case anybody's interested in that.
Okay, the number to the office is 618-358-0200, and we do try to do same-day admissions. So
that's good.
So if a patient calls in, we do try to get them scheduled that day.
That's important, because I think so many times that's a disconnect for so many folks, where they go, well, I don't have a week to wait, or I don't have 72 hours. I need it now, and I need help. And I think that's really good notes for the public too. And I think it's just important too to note just the different ways that you guys help folks that are going through the battle of addiction and other issues too, with when it stems from mental health and other aspects. And real quick, could you guys give me just an overview of some of those services? Because I know you added more to the psychological services department the last couple of years as well.
So we provide individual, couples, family counseling. In addition, we provide group counseling. This group that I've talked about today is one of 15 groups that we offer on a weekly basis. And so right now the specific groups span from age 9 through the lifespan. So, future plans to maybe bring that down even a little bit further, but that's where we're at now. In addition to that, we provide psychological testing, which is something that is pretty unique for this area as well, especially since we do accept all of the payers, right? That is very difficult to find. So we have Dr. Lakritz, who
He's
had on the
great,
show
yeah.
a few times, and he provides psychological testing, ages 12 and up.
Wow.
Yeah.
And that's really great to know. And that's just, it's better to know the information ahead of time than to need it right then and there. And as we go back into this, is it okay if we talk a little bit about what that first phone call kind of sounds like, just to get people a little bit familiar with the process, if they are a little nervous or just kind of want to be a little more prepared for their loved one or for themselves?
So like if the patient calls in, we take down like their demographics, what substance that they're struggling with, and kind of get like a feel of what their plans are once they leave
Gotcha.
detox. And then like some patients, they'll have us like they'll want to come in on a certain day, so then we'll go ahead and get them on the schedule. Pretty much that's about it.
And then after that, is it pretty much tailored to that individual from that step going on forward?
Yeah, so they'll come in they'll come in for their appointment, and then we do their assessment. As long as they meet criteria and they're in mild to moderate withdrawal, usually they're good to go for admission. So.
Wow. Well, and that's good to know, too. And it's a 3-day program,
Yeah.
correct? And then in those 3 days, and I don't know how much of this I can, ask or get into, how quickly do you start looking at that, the next step? When's step 2 getting
Day
looked at?
1.
Oh, really?
Yeah, so we start planning discharge,
Wow.
And the nursing team is really good at communicating with the New Vision team because they know that they're making those arrangements. Or if they talk with the patient themselves and try to, get what their plans are, they'll communicate that and vice versa. So we try to make sure that transition is as smooth as possible to ensure that one, we worry about that stigma, right? We worry about what their home life is when they go back. We worry about their support system and all those types of things. So that's where the nursing team is really good at.
That's so important. And just another plug for you guys' nursing team for getting that, recognition with distinction from Magnet. That's really important. And I think it's also important for folks to realize, too, that when they're going to this program, they're getting treated with the same care as everybody else. And I think that that's really important, like you said, just to go ahead and talk about that type of care, because you aren't looked at any differently. You're somebody that needs help and needs care, and I think that's so important for talking to a family member if they need to go do this, that aspect of it too. Yeah. Really, really unique. And as we're wrapping up this conversation, what's important to kind of hit home with or kind of drive home today before we say goodbye for now?
I don't know. That probably looks different for all of us, but for me, it's just exactly what you said. That we do treat everybody with the greatest care and love. That's our mission. That's our values, and we hold true to that in this situation.
And I think it'd be important to note that, as you mentioned before, it could look like many different points. It could be that emergency room visit for an accident that happened, right? And then the idea might get planted in their head, or maybe that conversation with their doctor. Yeah. But it really is it's a pathway.
Yeah.
Right? And I'm glad that we're there to be part of that path.
Yeah.
Shannon, anything else to add to this?
I agree with Staci and Charlotte as far as the care that we give them.
Well, keep up the great work. And what's that phone number again for your guys' department?
618-358-0200.
Absolutely. We'll link everything in a write-up on RiverBender.com, but just note out there that, just like we say with Centerstone, addiction can happen to anybody, but the good thing is so can recovery, and with partners like OSF Healthcare, there's a lot of great ways that you can start that process for yourself or your loved one, and we'll link that in an article. Back with more after this.